You're watching News at Prime. Let's get into another important conversation. The Rural Health Advocacy Project says the withdrawal of aid by the United States presents an opportunity for a new approach when it comes to the country's budget. The organization says 33 billion rand will be needed from National Treasury to alleviate pressure on the system and tackle debt in the provinces. Rural Health Advocacy Project's Russell Rensburg joining us now from Cape Town ahead of the budget tomorrow. Mr. Rensburg, good evening to you and thank you for your time. I'm interested in this new approach that you say this presents us with. What would it be? And keep in mind that the finance minister will always plead poverty.
I think health is a fundamental right in the South African Constitution. And I think the finance minister will be at pains to tell us tomorrow how 60% of the national budget is spent on the social wage, right? And, you know, the president also laid out some lofty goals, talking about these three apex priorities of economic growth, jobs, reducing the cost of living, and building a capable, ethical state. And I think state health services is part of that capable and ethical state, as it makes sure that over 80% of the population has access to healthcare services. So I think now coming after, like the minister said earlier, 10 wasted years and working our way through a pandemic, I think when we look at the health budget now, I think it's important that Treasury doesn't make the kind of policies that will constrain us, but rather provides us with additional funding to lay the foundation for building a new kind of approach to how we deliver healthcare services. And I think that's what we laid out in our press release today. Firstly, with a bailout to cover some significant spending pressures. But that bailout must be contingent on a number of different conditions, where all the provinces and the National Department can work together to work out a plan for the strengthening of the healthcare services over the next 3 years as we transition away from external funding from PEPFAR and the like.
Yeah. I don't know whether I'm conflating issues here, but I'll ask the question anyway. We talk about health services. Where does that put the NHI?
I think this is central to what the NHI was about. It was really looking about how do we use this fantastic state-funded system that we've had that hasn't been well-funded for at least the last 20 years. And how do we look at it to service a new kind of population? More than or close to 50% of our population is now under 35, right? Many of them are actually just younger than 15 or older than 15. And that means that we need to start reorientating our services towards a more youthful population, while at the same time also look, one of the successes of the HIV program is really the expansion in life expectancy. So now we need that system to also start gearing to the needs of older people. As you get older, your health needs change. And then, we've got these big goals around really ending HIV as a public health threat. Then that requires us to find 1 million missing ART patients. We want to reduce deaths associated with TB, which are currently 66,000. And then at the same time, we also want to start creating services like the president mentioned in his State of the Nation of reproductive and maternal child health services that every young family will need. So I think this is a good opportunity to start strengthening the public sector components of the NHI as we start looking at reforming the private sector to ensure that it better services the needs of the population. But like the minister said earlier, this is a new government. So I think the way that the NHI could be implemented now will be slightly different to what it was maybe 4 years ago. But there's always an opportunity, and I think this crisis presents a very good opportunity to start laying the foundations for building a better health system.
Yeah. There are some organizations that seem to suggest that this is also an opportunity to try and streamline government spending, basically consolidate all of these different funding methods, put them all together for a change in the country. And we might find that we actually do not need help from outsiders. Is that your view as well?
No, absolutely. I think we must be very grateful to the American people that through PEPFAR that have invested in the HIV response over the last 20 years. And I think without that investment, we wouldn't have a situation now where we're close to ending it. South Africa has 5.5 million people on treatment. we need to put another 1 million to achieve effective coverage. And a lot of that is being achieved because of the partnerships that are being created in the health system through local funding, which is over 80%, and some international funding from the US government and the Global Fund and the likes. But we are at that time where we with the right focus, we can actually transition away from donor support, and the support can maybe go to countries that are in much greater need than us. Because these PEPFAR cuts doesn't just affect South Africa. And when the program comes back, it'd be good to focus that program on the countries with the greatest need. And I think we can use the next 3 years to start transitioning our system into self-sufficiency, which I think we can do, but not in a rapid way. We have to be very measured about it. And I think that's why we made these proposals about the 33 billion rand bailout.
Yeah.
What that would do is it would provide 22 billion to the provinces to clear out the accruals. They've been underfunded, particularly on the HRH increase over the last 2 years. So they're running shortfalls, and those shortfalls have an impact into their subsequent year budgets. So if we want to get the system back on track, that's the first thing we do. The second thing in that 33 billion that we've highlighted was the 6 billion needed to transition the services currently provided by PEPFAR for the national health by the national health system, and we calculated that at around 6 billion. The further 6 billion is really about health system development. It's primarily for the employment of newly qualified medical graduates, nurses, pharmacists, doctors, as well as also finding us with the right kind of technical skills to start strengthening our support services in those 27 districts where we have relied on PEPFAR support. So I think this 33 billion, when you look at it in the context of state-owned enterprises receiving over 500 billion and likely to receive more with the economic focus on logistics, rail, and so forth,
Yeah.
I think this 33 billion is a very good investment in strengthening the health services for the entire community.
Yeah. Finally, on this 33 billion and how you've sort of split it in 3 ways. So you're saying it's got to go to the large majority of it. It has to go towards this the provinces to clear the debt. That's where it needs to go.
Correct.
So it one has to be channeled towards debt, but second of all, it's got to plug that PEPFAR gap, and then third and final, it's got to go through or go towards skills development, absorbing the new healthcare workers. But you're leaving out what I want to think is a very crucial element here, the infrastructure of the healthcare system in the provinces. Some of these hospitals are falling apart, or am I being alarmist here?
No, you're not. And I think at the end of the day, there's some opportunities to finance those differently. You know that there are 2 hospital projects in the Western Cape that will be privately built and then leased to the state. So you can spread the cost for strengthening those infrastructures over a longer period. And I think it's part of the public-private partnerships that the president spoke about, where the business sector can become a partner in the financing and the building of these facilities. So instead of the state putting out hundreds of millions of rands to try and do the work on an accrual budget basis, we could rather take on different blended finances approaches to strengthening that infrastructure as part of a much broader infrastructure South Africa plan. But I think the biggest investment that's included in the 6 billion of health system strengthening, including HRH, is the development of an electronic health record, right? Because data and the data digital architecture that goes with it is probably the most important investment, because good data allows for good governance and allows us to see the areas where we can grow. So I think there's room for a fair amount of different approaches to do this. But I think the main point that we'd like to make that is if we continue on the current trajectory, right, by just increasing health budgets by 3% to 4% and try and take a critical service like healthcare, and treat it like an expense rather than an investment, the capacity that we have at the moment will deteriorate further. So I think this government, and it is a new government, it's a multi-party coalition government of national unity, brings together different strengths. And I hope that through their collaboration and contestation, we have now agreed that health is a good right. And the president has indicated that we need to prioritize some of the more district-based services where all of the support would fit in nicely. So I think this is something that the government can get behind. But you can't pour old wine into new sacks. You have to really come up with a new plan. And I think this courageous plan of providing a significant bailout attached with some conditions to ensure that it's done correctly
Yeah.
can allow better collaboration across the system and strengthen the health system. I think this is the way we can look at it. We can't really control what happens outside of our country, but we do have control what we can do in response to the changing environment.
Russell Rensburg, thank you very much for your time and insights. He is with the Rural Health Advocacy Project.